you about compression therapy in terms of the management of lymphedema.
Well, Andrea, compression still is one of the mainstays of good quality treatment. And there are all sorts of ways we can apply compression from, as we all know, stockings and garments and wraps and all those sort of things, flat knit and round knits. And getting the right sort of compression is really, really important because it does make a difference. And when we're having compression on our limbs or our hand or our chest or somewhere like that, we have to make sure it's the right pressure and it's got a pressure gradient. And also for pressure, what we have to do is make sure wherever that fluid is going to, that we've created an empty space for it. The fluid and all the other things can move somewhere else and be taken away by our lymphatic system. So pressure on its own is fantastic, but it's made better when you prepare for the application of pressure.
Hi, my name is Monique Barham. I am the president of the Lymphedema Support Group of South Australia, and I live with breast cancer-related lymphedema. Today, I would like to present to you Compression for Lymphedema, the patient perspective. To start with, I would just like to give you some of my story so that you have an understanding of where I've come to be here today. At 37, I was diagnosed with a fairly aggressive breast cancer diagnosis, which led to some very aggressive treatment. And my treatment included to start with a sentinel node biopsy where they found some cancer and then went in for a complete axillar dissection where 26 nodes were removed. Followed very shortly by some fairly intense chemotherapy, which did include taxane-based chemotherapy, radiation to my breast and with booster shots to my axilla, which is my armpit, and also hormone therapy. I came to learn fairly quickly that all of this together, this collective range of treatments, put me at a fairly high risk of developing lymphedema after breast cancer. And very early on in my treatment phase, I developed the early stages of lymphedema. The middle picture at the top shows the swelling of my arm, and that's me making a joke of it because that was my way of actually handling the stress and the trauma of the swelling that I was encountering at the time. I was really lucky. I was able to get a very quick diagnosis early on, and I was also very fortunate to be able to access intensive bandaging. So the photo across to the side is me in treatment for lymphedema, for cancer. And as you can see, not very happy to have this additional therapy on top. So the bandaging that you can see in that picture is multi-layered bandaging. And what it meant was I had to, on top of my other treatments for cancer at the time, I was seeing a lymphedema therapist every 2 to 3 days to have the bandaging taken off, to have a little bit of massage and to be rebandaged. So it was quite an inconvenient and intrusive process. But to this day, I am just so grateful for the fact that I was able to go through it because it stabilised a very severe condition. And what it meant was that 10 years or more than 10 years down the track, I live with very well-managed lymphedema. So as much as it was difficult at the time, I would never go back and not do it again. Bandaging is an option that I still actually have today, but I don't need to do it very often. Thanks to the compression garment subsidy scheme that we have here in South Australia and the improving public lymphedema services, I was able to actually access 10 days of bandaging early this year just to stabilise my condition before I was measured for my new compression garments. And it was really exciting because I managed to reduce my arm by 1 centimetre, which is quite a massive thing for me. But more than that, I really couldn't believe actually how physically I felt so much better. I hadn't realised actually how unwell I had started to become. So I felt so much better, and emotionally, of course, it just made such a huge difference. And I was able to get into these lovely new compression garments, which just fit beautifully and make me feel really good. So that's a really, really good, good story, I think. As I said, bandaging is not something I need to do all the time now, but it is part of my toolkit. So what I'd like to just start with is just to mention what exactly is my toolkit and how do I manage my lymphedema. On this slide, I'm going through my lymphedema toolkit. So this is what I have worked out over many years in conjunction with discussions with my lymphedema therapists, what works for me. Your toolkit may look different, and it really is important that you work with your therapist to find out what treatments and regimes work for you. But just so you can see what it is, what my daily life looks like with lymphedema, here is a bit of a snapshot. As I said earlier, compression is really important. In fact, for me, it is the bedrock of my management regime. I wear compression of some form or another 24 hours a day, 7 days a week. Bandaging, as I said, is also something that is now more of an option to me, and it is something that I can also do at home if I feel that I just need a little bit of extra compression. Skincare is of vital importance. Your skin is a barrier to infection, and those with lymphedema have not as good an immune system in your affected areas. So if there's any breaks of the skin or cuts or scratches, really need to keep that skin clean and make sure you attend to any cuts or scratches fairly quickly. I also have laser treatment. From time to time, I go to a therapist that offers specialised laser treatment for lymphedema, but I also have a little handheld laser that I'm able to use at home, which I use most days. Self-massage and breathing is always really good. It just actually makes me feel better anyway. It's actually a little bit of time every day that I set aside to just look after me, so that's really good. It might seem counterintuitive, but drinking lots of water is really important. Keeping well hydrated and allowing the lymphatic system to keep flushed is really good. And again, it just makes me feel better. MLD is when I go and see my therapist for specialised lymphedema massage therapy. And sometimes I can get some taping. That's that picture of my hand with that lovely black sort of tape on the tops of my hands. That works really well for me too. Diet and exercise is important, and peer support is really important. Just having that time to connect with others who understand what you're living with, getting hints and tips from other people. It's amazing how much you learn. And also just on those days when you don't want a lymphedema anymore, it's just nice to talk to someone and they kind of, just have a cuppa and share how you're feeling is really good. I'm also able to investigate the possibilities of what's called an LVA, which is a lymphovenous anastomosis surgery. And that's that little picture at the top with the little green squiggles on my hand. That's where my lymphatics are working on my arm. Not very much there, but there may be a little bit there that a surgeon might be able to work with to get my arm to work better. That's something that I'm looking at as a possibility in the future. But as you can see, it is a toolkit that is a full-time job. But I just have to point out very clearly is that the benefits of doing this are amazing. After over 10 years of living with lymphedema, I'm still living a very productive, if somewhat different life than I had anticipated. But lymphedema is part of my life, but it doesn't rule my life. So looking more closely at what my compression routine is, because that's what we're really talking about in this session tonight, about compression garments and how that is so vitally important for the management of lymphedema. As I said earlier, my compression routine basically means is that I'm in compression 24 hours a day, 7 days a week. When I say that, there are little breaks, obviously, in the mornings and in the evenings. And I do take breaks from it from time to time when I feel I can. But this is what it really does mean for me. Every day I have a pair of daytime garments. They, for me, are made to measure, which means they have been measured specifically for my arm and for my exact to fit me exactly. I wear one class 2 flat knit sleeve, and your therapist can advise you on that, and one class 2 flat knit glove. So you can see that in the picture. And the little pink glove next to it is actually my donning help. So donning is that term that you hear, donning and doffing, putting your garments on and taking them off. They can be a little bit tricky to get on and off because they are very firm, and they need to be firm. It's graduated compression, which is exactly what you need. So that little pink glove just helps me get them on and make sure that they're all sort of fitted properly onto my arm every day. At the end of the day, I take them off and give myself a little bit of a break. And then I do have nighttime garments as well. So that's that sort of bumpy sleeve and glove that you can see. So I have a foam bandage sleeve and a foam bandage glove, and they come in different versions of them. And you can see the picture of my hand next to it with all the little bumps all over it. That's what I wake up to in the morning after that night sleeve and glove has been doing its job. Now, I personally can't go to sleep without it. Some people find them a little bit tricky and don't want them all the time, and it's individual preference. But for me, it has become I just feel so good in the morning when I've got it on. My lymph feels good. I just wouldn't be without them. As I said earlier, I also access some therapist bandaging from time to time, but I also do a little bit of self-bandaging, and it's fairly easy. Basically, I just have a short stretch bandage that if my arm is feeling a little bit that it's getting a bit fuller than I would like it to be in the evenings when I'm watching TV, I just wrap that over the top of my nighttime garments and just squeeze. I have a little squeeze ball that I basically do while I'm watching TV, and that just helps to bring my arm a little bit more under, it stabilises anything that might be going on there. That's my compression routine basically on a daily basis. Now that looks like a lot, and I do understand that it might seem a little bit daunting, but what I will say is that if you do keep on top of this, it is okay to not compression every once in a while. Some days I just don't feel like doing it, and that's okay. But what I do know is if I am going to take a break from compression, I'm going to either have to plan for it in advance. Sometimes, for example, if I'm going out to an event and I just don't really want to wear that garment with that lovely pretty short sleeve dress that I have, I just plan a little bit in advance. So I might do a little bit of extra massage at home, a little bit of self-bandaging, a little bit of extra laser, make sure I've drunk lots of water to keep myself hydrated. And then I know I can skip out with my little dress and get away with it for an evening or so. But I know when my arm is starting to ask for compression again. So I think what's really important is to plan and also listen to your body. So for me, the first signs that my arm is wanting some compression if I've taken a bit of a break is it starts to feel a little bit heavy. I get a little bit of tingling. Also, sometimes it feels a bit warm and I can be a little bit achy. And so I know, okay, I've taken a bit of a break, that's fine, but now I need to get back to my regime and give it a little bit of TLC. And I find that doing that from time to time just makes me feel better, and and having a break, it's just natural. You want to do it every once in a while, and it's okay then to get back onto it, onto the regime again. So I just wanted to end on a little bit of a lighter note, because I really do know that living with lymphedema does mean making lifestyle choices, and it does mean a commitment to you looking after your health so that you can manage your condition effectively. And this just always makes me laugh, because any person who has arm lymphedema will know that when you're donning your sleeve, it's so easy to just easily smack yourself in the face. And there isn't a single one of us at our coffee catch-ups that hasn't had a laugh about that and in an embarrassed way, disclosing they think they're the only one. You're not the only one. We've all done it. So it's really important to keep a bit of a sense of humour about the condition, because a sense of humour just can really, really help things when you're having those hard days. I just want to also say it's really important that you work with your therapist to find out what is the right compression and the right toolkit to manage your lymphedema. Thanks to the compression garment subsidy scheme that we have here now in South Australia, you're actually more and more people in South Australia are able to access their compression garments that they need, and more public services are becoming available. So we really are very fortunate now that we are able to live better with lymphedema here in South Australia. So just to finish, I would like to really thank the people that have helped us bring this together, particularly Andrea Mannion, who has been an amazing support and font of knowledge in helping us put this series of information sessions together for you. Also, as always, Professor Pillar, patron of the LSGSA and director of the Flinders Medical Centre Lymphedema Research Unit. He's always there to answer our questions and to support the consumer group in all that we do. And I also really want to thank our LSGSA committee, this wonderful group of dedicated volunteers that just work behind the scenes to get everything happening. And last but certainly not least, our members and our friends. Without our members and friends, we just simply wouldn't exist. So if you would like to become a member, if you would like to become a friend, or if you would just like to support the LSGSA, here is how you can contact us and connect with us. If you would just like to ring us for a chat, that's fine too. We are a lovely bunch of warm people. We get together regularly for coffee catch-ups. Check us out on Facebook, check out our website, contact the wonderful Deb, our secretary, and hopefully this has been a fantastic resource for you. Hopefully it helps you, and hopefully we might get to chat to you in the future. Thank you very much.
Hello, my name is Andrea and I'm a lymphedema physiotherapist. And in this short presentation, I'm going to give you an overview of compression therapy for lymphedema, specifically focusing on breast cancer-related lymphedema, which is in alignment with Monique's case, which she has shared with you before in regards to how she manages her lymphedema. Now, compression therapy takes many different forms. So there are bandages that can be applied, there are wrap-style garments that can be applied, and then many other different types of garments that come in various different types of fabrics, such as circular knit garments, which are quite stretchy, or flat knit garments, which are a little bit more rigid. And then there are also compression therapy pumps. In this short presentation, I'm going to focus on the utilization of compression garments and give you some examples of what types of garments are used in research trials when they're looking at whether garments actually work for lymphedema. But before diving a little bit deeper into compression garments, I just want to tie into what Professor Neil Pillar spoke about in his short introduction with garments, is that when we are looking at placing one of our patients into compression therapy, we need to make sure that their body is ready for compression therapy. So if you're watching this and thinking about managing your own lymphedema, as a therapist, we always make sure we prepare your body, we prepare our patients' bodies for compression therapy, and we do that by doing things such as manual lymphatic drainage, decongestive exercises and deep breathing, and then other forms of exercise such as resistance training or cardiovascular exercise. And that's because we want to make sure we've got somewhere for this fluid to go, because basically with compression therapy, we're just physically squeezing. So if we think about the arm, for example, we're just going to be physically squeezing the arm and trying to direct all of that fluid to the main lymph node basin, which is the axilla, is a fancy term for the armpit. So we're trying with our arm compression, for example, to direct that fluid to those lymph nodes. And so that's where we need to make sure that the body is ready to receive that fluid. And that's where, if we are talking about breast cancer-related lymphedema, we would be making sure that we were treating the armpit and making sure that the armpit was ready to receive that additional fluid. So a professionally prescribed compression garment can definitely assist with lymphedema. And I'm allowed to say that because compression garments are the most evidence-based modality when it comes to managing lymphedema. So there are some things that we get quite excited about. For example, manual lymphatic drainage. laser, for example, negative pressure, other forms of lymphatic treatments. But when we look at what has the most scientific research behind it, it's actually compression garments. And let's explore what some of that research actually says. So are compression garments evidence-based? Yes, they are. And research studies have shown that early compression garmenting can improve lymphedema and in some patients stop it from progressing. Now, this is when we intervene very early on. Safe prescription is important, meaning that you do not want a garment to cause harm or block off lymph flow. Now, that's really important. So therefore, seeing a suitably qualified lymphedema therapist is therefore quite important as part of your overall prescription. So let's look at two examples of the research. So in a study by Pat Whitworth and colleagues, 93 breast cancer patients were monitored for just over 5 years. The only intervention was the application of a ready-to-wear sleeve, followed by re-evaluation after 4 weeks. Now, 35.4% of this cohort, so just over 1/3 of this group of patients, required a compression sleeve due to high tissue fluid levels being detected. So at this very early stage, before we could actually detect it with a tape measure, these patients were identified as having abnormal tissue fluid levels. At the end of this particular research study, only 3% of the group had lymphedema at the last follow-up. And this showed that the intervention by going into a compression sleeve worked quite effectively. Another example is a study by Nicole Stout and colleagues, and they looked at 196 breast cancer patients who were monitored for lymphedema. Limb volume, so how large the arm actually was measured preoperatively and at 3-month intervals after surgery. Okay, so these patients were followed quite closely, which is what the scientific literature now recommends. If an increase of greater than 3% in upper limb volume developed, so that's quite a small change occurred, compared to what they were pre-surgery, so that's prior to having any breast cancer treatment, then a diagnosis of lymphedema was made and a compression garment was prescribed for 4 weeks. So the garment that was provided, to give you an idea of what they were using in this study, it was an off-the-shelf compression sleeve in 20 to 30 millimeters of compression, and it was a sleeve and something that went over the hand. So a gauntlet is described as something that goes right up to the knuckle. So we weren't just stopping at the wrist, we were going all the way up to the hand. And they were fitted for the garment properly by a physiotherapist. 2 patients required custom-made garments because their limbs exceeded the length that was available in a ready-to-wear garment. Now, this is important because not everyone's going to fit an off-the-shelf sleeve, and it's really important that you're fitted appropriately, as I've said before, because if you wrap a really tight elastic band around your wrist, your hand may swell because of that, even if you didn't have lymphedema. We don't go tying really tight things around our wrists normally. So when we're wearing compression therapy, it's really important, or when we're prescribing compression therapy as a therapist, it's really important that we do not cause any harm. So if someone doesn't fit an off-the-shelf product, then it's important that they are prescribed a custom-made product. And it's important, if you're a patient watching this, that you know that if you're going into an off-the-shelf product, you really need to make sure that you're fitted properly and you fit within that sizing range. So the authors of this study concluded that a short trial of compression garments effectively treated subclinical lymphedema. Now, what subclinical lymphedema refers to is subclinical, meaning before clinical or established lymphedema becomes prominent within the tissues. So intervening very early on is now recommended for anyone that's had breast cancer treatment. And the results are quite positive, showing that if you can intervene quite early and get very good treatment early on, looking after your body early before, and rather than waiting before there's an established problem, then we're able to get better results. So early intervention normally requires circular knit ready-to-wear compression sleeves, such as the one that's pictured on the screen, in a class 1 or class 2. So you'll hear both compression levels spoken about as well as compression classes that are spoken about. When you start hearing compression class 3, for example, that's spoken about, that's normally for the lower limb and in someone that has much more severe lymphedema affecting the lower limb. So the back of the hand is normally included via an arm sleeve that also includes the hand, or via an arm sleeve that has a separate piece for the hand. Any garment must fit well and must not cause any pain or discomfort, and seeing a suitably qualified lymphedema therapist for prescription therefore becomes important. So some key messages for you to remember: garments are an evidence-based strategy that can be effective as an early strategy for managing breast cancer-related lymphedema, and appropriate garment prescription is important by a trained lymphedema therapist. We really hope that this short 30-minute overview of compression garmenting is empowering for you. We really want you to understand that lymphedema can be managed well. It can be managed really well too if it's managed very early on. So we encourage you to be empowered by education and seek early care. Thank you.